We are here today because Crozer was a critically important healthcare system right here in Delaware County. A healthcare system that has been forced to close its doors and stop serving its patients because of the greed and mismanagement of a private equity firm. The team of healthcare providers who worked here, well, they delivered life-saving, quality healthcare to the people who lived in this community. They held up their end of the bargain. People like Peggy Malone did it for nearly 4 decades as a nurse. Dr. Cooper did it for almost a decade. They did their part. They served their community and their patients.
We're going to reimagine healthcare in Delaware County and build a better future. Not long ago, 576,000 people once had 6 great hospitals to care for their families and loved ones. Now they have just 2. If there's one thing I want you to understand, it's this. It doesn't have to be this way. Private equity has no place in healthcare. But let's be clear about something. Private equity doesn't belong anywhere else either. On Tuesday, we brought more than 200 employers together to support over 1,000 job seekers from the former Crozer staff. Here in Delco, we've been wrapping our arms around our brothers and sisters in the Crozer workforce who need new opportunities. We've been working around the clock to support patients and residents and to make sure our other providers can do their best to care for our folks that need it.
We know how to come together and solve problems, and solving problems requires compromise. I want to have a strong bill, a bill that protects communities from the kind of profit-seeking motives that we saw here in Delaware County, but I'm never going to let the perfect be the enemy of the possible. Hospitals, especially our rural hospitals and some of our urban hospitals, make a considerable amount of their dollars from patients who enter their ERs, enter their medical exam rooms, being covered by Medicaid. Some of these rural hospitals, including one I was just at, the Northern Tier recently, about 60% of their revenues come from Medicaid, and they're operating on a less than 1% margin. So if you go trim $3, $4, $5, $6 billion out of the state share of Medicaid, you're not only knocking people off of their health care, you are determining that these rural hospitals, these hospitals that rely so much on Medicaid, will have to shutter as well. And you're exacerbating the healthcare crisis that's brewing in our Commonwealth. Understand Medicaid is funded in part with federal dollars, roughly $30 billion, and in part with state dollars, roughly $20 billion. And then it's administered in our Commonwealth. They're talking in DC. Now, who the hell knows what they'll do at the end of the day or what the final bill will be. But as they're talking now, they'll be knocking about 750,000 Pennsylvanians off of Medicaid. They will trim benefits for those that remain, and understand there are 3.1 million Pennsylvanians who receive their health care coverage through Medicaid. We're talking about people who are disabled. We're talking about seniors and babies and others who are working, and just can't make enough money to be able to access private health insurance elsewhere. So we're talking about knocking 750,000 people off of healthcare, trimming the benefits for others. By the way, to pay for a tax cut for those at the highest income brackets in DC. And that, to me, is something that is really, really troubling and would have a devastating impact on people in Pennsylvania.